Okay, Lidewij, it's really nice to have you as my guest,
Thank
and I'm very happy. We met
Mhm.
last year May in the Netherlands during a day of breathwork
Yes.
coaches, and to be honest, that was an environment where I would not have expected you to see
Mhm.
there because you are a
Mhm.
physician, a plastic
Mhm.
surgeon. And yeah, why would you attend an event for breathwork coaches? So it was a very nice session, a very profound session. And I was also triggered by the fact, why were you there? And what is leading you to be on one hand a physician and on the other hand being engaged and involved in breathwork and hypnotherapy, which is also what you're doing.
Well, that was a huge event and it was great to do that. It actually got me a little nervous also to do that because I was guiding a group of, what was it, like 80 plus breathwork coaches who do
Yes.
this every day.
Yeah.
And here I was, a doctor who also is a breathwork facilitator. And I was mixing it with hypnotherapy, which was another skill I learned through training. And I was blending it in because I love in my work as a reconstructive surgeon that, I have skills to physically put tissues together. And then the healing actually starts in between the stitches. That is the physical body of the client, of the patient, repairing after I've done the surgery. And there's so much power in that. If you realize that it is your body and your body's innate intelligence repairing that. So it's not just what you eat and how you deal with rest and with sleep and with recovery and therefore with stress and movement, but it's also your mind because your mind has such a profound impact in your body. And that's really mind body medicine that I love too. So hypnotherapy obviously is a very strong tool to access the subconscious mind, which dictates like 95% of our daily decisions. So basically, we're mostly unaware what is driving our behavior, but it has a profound impact. So using that in a session like connected breathing, where we open our awareness, our consciousness to an extended field, and then imbuing that not just with your own connection to that expanded field, but to basically impregnate that state with hypnotherapy designed to provide healing for the physical system, for the body, for the energy. Yeah, that's what I tried. And that's also what made me a little nervous because it was something I came up with the summer before during the Global Inspirational Conference. This is where I met Nikki because Nikki of the Breathwork Movement, she was in my session and she was like, whoa, please, we have to work together. So that's where the invitation came from. But obviously, although I love what I do and I'm convinced that hypnotherapy is a very powerful tool in helping people, well, first off, understand what certain parts of their behavior or decisions in daily life come from, but also to alter that the way they can make decisions or live their life or to see things and therefore impact their health and well-being. It was a beautiful mixture with the breath work, which is a great tool, not just for stress release, as you know, being a breathwork facilitator yourself, but also to access deeper emotions and to at some point even open up clarity about, well, whatever your soul is messaging to you. So to basically reconnect to the innate intelligence of the body, of the soul, of that larger thing that makes life possible for every one of us, right? Because there is an overriding intelligence that goes far beyond the best skilled surgeon who knows how to do surgery. And there is the innate intelligence of the physical system of the body that we are dealing with. So yeah, to better understand that and to see how stress is impacting our system, not just emotionally, mentally, but also physically. That was a profound change in the course of my work over the years. And this is why I think hypnotherapy, breath work, body work are all tools to help the physical body get back into a state where the healing, the innate healing it always wants to achieve for us, is more easily reached. So, although as a surgeon, it's just great to be in control, to decide where to cut, when to cut, and how to put it back together and fix it right on the spot. I mean, that's beautiful. And I love doing that. And it's very helpful, specifically in breast reconstruction. What I do, I actually make breasts where they've been taken away. But it's just the actual act of surgery is only one part. And there's so much more to it. And the healing can positively be impacted if you are aware of your own impact on your physical system, on your well being, on your healing, not just in the choices you make when it comes to food, sleep, rest, movement, but also the unconscious patterns of your emotions and how you deal with them, because they influence, the stress level in your body, and thus physiological processes, meaning processes in your body, like heart rate, blood pressure, but also how your body is paying attention to either immunity or rest and repair, digestion, all that stuff. So yeah, the mind is powerful, and the body has an innate intelligence. These are two things that are very much a part of the work that I do.
Yeah, healing in between the stitches, you said, huh? So the sound is really, it could be the title of a nice book. I think it resonates a lot. So in your work in the hospital, are you implementing then also these techniques before people come to you? Because I imagine when you are more relaxed, more calm, undergoing any kind of procedure, the healing process will also be better or
Yes.
improved.
Well, actually, yes, that speaks for itself. If you are more stressed before going into surgery, you often need more drugs to be under general anesthesia. And if you need more drugs,
Mhm.
there's going to be more side effects. And then it will take longer for you to get out of that, to get rid of the drugs after the surgery is done. And that has been studied before, and it's profound. So if you find ways to be calm and regulated, and also be empowered to do that for yourself, even if it's simply listening to something and, going with that audio tape or a visualization that you can all do, it helps you go through the experience with more trust, with more calmness. And that is a very different state than when you're high stress and feel you have lost all control. We see that regularly. So this is general anesthesia, but of course I also do procedures under local anesthesia, meaning that I actually give, the painkiller in a syringe. I make a stick. So that is, of course, also scary for people because it's painful when it happens, and it's often in the face in my occasion or in the hands. So even there, little breathing exercises where you focus on exhaling, releasing the stress that's building up, releasing the pain, telling yourself, this is painful, but it will go away 10 seconds, because that's what's happening, is helpful. Because the moment people stress out about that or hold the tension inside, their blood pressure is racing, their heart rate is racing, and both contribute to more bleeding in the affected area. So then I need to do more unpleasant things to control the bleeding, and that impairs the healing in the long run too, because you're going to coagulate more and burn more blood vessels. That means so yeah, it is so much better if you can be part of your own healing by being more regulated, able to deal with your stress in that moment. And I think it's up to us healthcare providers to become aware and to help our patients, because it's so much nicer to just, of course you have to be very skilled as a surgeon to know when to operate and how to do it and how to handle the tissues, but it's really because of the intelligence of the body that we are able to do this work. And we should not neglect the impact the person, the client, the patient actually has on the whole healing process. And that is empowerment. And I think what we need in healthcare right now specifically is more empowerment for the patient and the client, because with empowerment, it comes from more responsibility. And that can only be created through insights, through education, through awareness of what health actually is and how you can achieve it, how you can improve it. I do believe that that is something we in healthcare should pay more attention to. Be more open about that and not just wait for people to fall sick to get sick, because in general that is an accumulation of decisions, of events, of choices, mostly unaware, that eventually lead to illness, disease, and exhaustion. And yeah, that's when people finally show up in the hospital. So more collaboration with the patient, the client, more awareness on health and well-being and what you can do to support yourself and to support the highly intelligent human body. I think that is the way to reduce the pressure of allostatic load, we say. So the amount of disease present in society nowadays on the healthcare system, because we live longer, but in the years that we live longer, there's even more years with chronic illness like high blood pressure, obesity, diabetes, all of that stuff.
Yeah, that's true. The quality of life didn't increase with the amount of years we live.
No, not
So
necessarily.
therefore, it's even more important to go back to the responsibility of the person, and also to make them aware. So in the hospital where you work, is there then a special, how you say, process to guide the people of increasing awareness? Because time is also always an issue when you look at the current healthcare. So do you see, is it already something which you're implementing, or is it still something specifically what you address? Because I can also imagine in a healthcare environment is a lot of rational
Yes.
mindset, and there is not yet enough space for another type of awareness, your own responsibilities. So where are we at the moment?
Do I implement it? Yes, where possible, and also where not always possible. So I don't have the time, but I still, take some extra time to explain
Yeah.
certain aspects of this. But in general, prevention and lifestyle is not like on the top interests of the hospital. This has specifically been explained. We do other stuff. We're good at diagnosis, treatment, and follow up, but we hardly have space to do anything with the stress of the diagnosis, the treatment, or the follow up, you know. But that is an essential part. And prevention would, in the end, mean that people may not have to come to the hospital in many cases. So, yeah, that is also a little strange. And hospitals nowadays have, there are also companies that need to stay afloat and stay alive. So it's
Yes.
very intriguing how this is all influenced, because we see more complications in people who have been dealing with more chronic illnesses over time. They don't recover so fast. So, there's strategies developed for people who undergo big surgery, like colon, like a gut surgery, like for colon cancer, for instance, because we know there's going to be a time where they are not able to process food normally. So they actually get this whole treatment before the surgery, a prehabilitation, it is
Mhm.
called, information on food and recommendations on walking outside, on going to nature, on speaking to loved ones, on quitting alcohol and smoking, on getting enough rest, on movement itself. It's fascinating. Why do we do it for that group? And why don't we do it for like everybody? Because I surely believe that everybody would benefit if we show up for any kind of treatment in the best possible way. And even then, because not everyone has the chance to prepare themselves in that way, because we don't have the time, there's an acute problem, or we have been unaware until the moment of, total accumulation and then an event. But in general, doing stuff that supports the innate intelligence of the body will help you recover faster. The body needs certain nutrients from the food that we eat in order to be able to implement them in healing. And a lot of the food that we are offered in supermarkets, and sometimes even in hospital food, is not necessarily imbued it with all these nutrients, you know. So that is a first step. But the stress, to get back to that, the stress related around diagnosis, treatment, and follow up, that is something that we should address definitely more in the hospital setting. And at the same
I think what you with stress in related to disease or to a procedure,
time,
probably people don't even realize that they are stressed or under tension, that it creates that it has an effect in their body, that it changes
Mhm.
things. That could also be right.
Yes, yes. Well, although most people, when they are finally there, they feel it.
Uh,
We're good at
when
missing
they're
it.
finally there, yeah.
Also, it's a challenge. Like in my profession, there's a lot of elective surgery, so people actually choose to have a procedure. Even when it comes to
Yeah.
breast reconstruction, it's not life. Your life doesn't depend on it, but it's life changing. And then that amount of choice may even flood your system even more. Because if you're all, you feel like you're almost dying and you're in the ER and your belly hurts like crazy, you're like, whatever you do, you just need, help me. And if you have a choice in the matter, that might even increase the amount of stress you have around making the right choice and the outcome that you might expect.
And how did you come? How did your interest of also this aspect, or the more
Mhm.
holistic aspect of prevention, taking good care of your body, how did it collide with your profession as a surgeon, as a physician?
Well, first off, when I was a resident in surgery, I had just written my PhD
Yeah.
thesis on breast cancer. And then during your training, you obviously start with smaller surgery. And then one day I was allowed to do the bigger surgery, like a
Mhm.
mastectomy being the removal of the breast in case of cancer, which is effective for sure, but it's very mutilating. And, despite the fact that I was trying to do it very nice and make the stitches look nice, it was just, very disruptive for the female body, and it was
Mm.
never really nice, because it's disfiguring. At least that's what many women will feel after the surgery. So I was disappointed at the time. I remember I was in my 20s, was like, whoa, this is where we are, the current state of healthcare, that we wait for
Mhm.
a number of cells to dysregulate and then expand and then become so many that we simply cut out a whole body part to say then, see, now I cured you, huh? And I thought that was sad in a way. I mean, it's great that we can do it. We can then stop the disease, but why can we not stop it way before it gets to the point where you had to cut out so much of a female body before healing can start? And so that was a quick thought, but then also I loved surgery. I loved fixing it on the spot. So I wanted to continue there. And then I saw a reconstructive surgeon step in and do a breast reconstruction. So, and that's eventually when I thought, okay, so if I clearly cannot yet stop it at the entrance, then I might as well specialize in reconstructing it at the back end. So really at the end of the chain, really. So, and I love doing that because it offers or asks a lot of creativity to take out little tumors also in the face, around the eyes, the ears, the nose, and to find creative ways to reconstruct it in a way that is, restoring form or function. So that's a beautiful part of my specialty. But then to get back to this, how did I get here? Personally, I experienced a huge transformation after one of my children was diagnosed with Burkitt's lymphoma, which is a highly aggressive type of lymph node cancer, lymphoma. And it spreads throughout the entire body very fast, as it had with him. So it was all over his body. He was 6 years old. He was very sick. So by the time, after a couple of days in the hospital, when they finally, to our understanding, like after 4 days, finally they came up with a diagnosis, and it was cancer. And like at that point, it wasn't even scary anymore that it was cancer. It was more like, thank goodness you found a diagnosis. You've heard of
Mm.
it before. I remember asking, okay, and you have treated children with this before? Yes, there's 12 children in the country every year who get this diagnosis. Well, luckily, I had a supervisor from my time in Boston that also knew this disease and what had been head of the transplant unit for children on this topic. So she was very aware and offered support in
Mhm.
various ways. But anyways, they knew what to do. So my son was hospitalized immediately and treated like the next day after the diagnosis because it was that aggressive. He was in the ICU after 10 days and he did not leave the hospital the first 3 months of his admission. And it was horrible. I was not working. I was not seeing my other two children, and our complete family structure was disrupted. Hardly any social life, other than so many of the people in our village and school who brought food 3, 4 times a week to our door, multiple courses and gifts, and they picked up our children. That was amazing. But true emotional support for what we were going through, it was hardly possible because it was so huge. And in that time, the only thing I could do when not really having control of what was happening was just to be present with my child and support him. And there was no true time for me to deal with the stress of this other than to be hyper alert of the drugs that were ready for him and sometimes point out differences. But then after he was treated. And luckily he made it through. He got better. He's still here. He is better. He survived. And that was really amazing. But after that, I realized, oh my goodness, what did we go through? And yeah, it impacted our family structure in such a way that it completely fell apart. Our marriage fell apart too. So on top of not having worked for that year and not having had a social life, then this also happened. I had to move out of the house eventually after some years with the children. And that was so much. It was with all the emotions I did not have time to process in that one year. I needed something. I finally turned to like meditation, mindfulness, breath work, body work like yoga, to access and process emotions that I had not had time to process during his illness, and became very aware of the amount of stress that, well, I had been under, but also parents in this situation are under, and children in this situation are under. So that led me to a path of integrative medicine. I am a trained integrative medicine specialist and lifestyle specialist, because in general, it's much more than, shoving in some calories, taking a break when you want, dealing with stress by alcohol. That's not the way for an optimal life. We have to become aware that the choices that we make, not just in food, but also in how we divide our energy, are impacting our health and well-being. This is why I turned to study the, hypnotherapy, breath work, body work, integrative medicine, because I think the choices that we make mostly unconsciously every day, they build up cumulative to our state of being and the choices we make and the well-being um, experience and the health for that matter. So if we can impact that, uh, the awareness of the impact we actually have on our health and well-being, and also understand what our choices come from, what our triggers come from, and how we can maybe change our perspective or let go or find a different approach, then we can make better choices. And then we can not only alter our life, but also through that, we alter the state that we are in. And if we can alter the state we are in, especially when we have been in stressful conditions, it impacts our surroundings, the people that we deal with. Therefore, I think in general that if we can manage to find ways to change from within, this is the way to change how we interact and deal with each other in this world.
Yeah, if you have been so long under stress, you're basically in survival
Yes.
modus, no? You want your child to be
Mhm.
safe. Just this is the one focus. You go for it, and then it's also okay that you, for a
Yeah.
period, even though a year is a long period, that you're in that state of hyper alert, and that you also realize then, and I think that is the good thing here, that you realize that you were in that stage and that was not healthy for you on the longer term. So you were looking for tools how to rebalance
Yes.
it, no? Which then probably also took another year to find this kind of
Yeah.
balance. Many people don't realize that they're building up the stress
Mhm.
levels until it's maybe yourself. Nowadays, are you having now a daily routine to manage the stressors better? Because the stress doesn't go away. It's more how you manage it with whatever comes to
Yeah.
you.
Well, stress first and foremost is through your filter,
Yeah.
the interpretation of whatever is happening either inside or outside of you, right? It's the meaning you attach to
Yes.
whatever is happening that creates the stress. So you feel pain and it could upset you, or you could think, oh yeah, that's my body healing. That is first and foremost. But then secondly, what do I do? Yeah, for 10 years I have a routine. In that time I needed something. I remember I was talking to a psychologist at that time that I had started talking to after my son was cleared, was going back to school. I was like, okay, I need something. I don't know what. But I was sitting there talking, which was nice, venting. But then for 2 weeks, I went home, and then what? So I needed something. And at first, I thought, like meditation, what's that going to do for me? It did not really help me in the beginning.
Like many people
Yes.
think that.
No, it was difficult because I was sitting there with all these racing thoughts in this survival state I was still in, and now I was closing my eyes and I was instructed to not think about anything other than just following my breath. Very simple assignment, but so difficult to complete. It was horrible. But eventually I somehow,
Yeah.
because I'm a surgeon, and so I can really, like a pit bull, get into something and do it. I think that saved me in the moment, because after a while, completing 10 and then 30 days of doing at least some meditation per day. Then I did a mindfulness training too, where you really shift from your mind into the body, into the feeling body, becoming aware of all the sensory organs, the skin, how you are in your body, because in essence, we are a soul in a physical body, and our body is giving us clues all the time about our state of being, about how we're doing. It's not just a body, it's really, it's a sensory system, it's an antenna, and it's giving us information, and through our body we are giving out information. So this is where regulation comes in. I started doing breath work and using the breath, because breath is, as you obviously are aware of, is one of the first things that noticeably changes when we are dealing with stress. We breathe
Yes.
shallower, more frequently, more superficial, higher up in the chest. And this is not only something you can notice, but it's also affecting inside. It affects our biochemistry. Like, it changes the O2 and the CO2 levels in the blood, and that affects how bodily processes are happening inside of your body. So breath work is a very powerful and quick reset to change your state of being. If you're in stress and you realize your breathing pattern and you actively change it into, de-stressing, into breathing less frequently, lower into the belly, longer exhale, you activate that parasympathetic part of the nervous system that so many more people have heard about nowadays, luckily. And therefore, we change the state of our nervous system into a more parasympathetic state of rest, of repair, of healing, of digestion. Breath work is amazing. And also body work is something I added over the years. I was doing yoga, but now I'm even into more of the body work, even activating the body as part of healing processes, of becoming aware of stored emotions. Often we're not aware. I'm not aware. Sometimes I can feel like I'm sitting on some sadness or grief, and I could tell my children this. I'm sitting on some grief and I can't reach it. So I'll go up, to my room and do some connected breathing, or do some activation tapping, and then I get to it, or do some body work, moving stretches that somehow reach part of your emotional being that can then open up and be finally met with presence, so you can process it. And that is something added over the years. So do I have a practice, you asked? Yes. Every morning I sit, and it started with years of doing meditation every morning, and at some point I was doing it 20 minutes every morning, even before my surgery days that start really early, but specifically on those days, because the switch from a state where I can really be with myself in quiet, to being in the hospital where I'm the surgeon, where, everything is thrown at me and I'm in control, in high achieving sympathetic mode. It's a big shift every day, and I can do it, but it's very different. So to prepare and to start the day with a moment of rest, of relaxation, of connection, of intention really helps out, because just as in athletics, as I try to explain to my teenage boys, when something happens, you can run quite fast. If there's a danger now, you can sprint, but you cannot really sprint that long. If you want to sprint longer, further, faster, you need to train your body. It's as simple as that. Or, if you want to build muscle, you have to go to the gym regularly. And it's the same with training your awareness muscle, and also getting your body used to the effects of these practices of breath work, of body work, of meditation. And if you find a ritual for yourself, preferably at the start of a day when not everything of the day, all the demands of the day have already tripped over you, because, I love my job, but there's a lot going on all the time. And then I have 3 teenage boys. So, to mention just 2 of the things in my life. So in the morning before the day starts, I have a connection with myself, with my body. It trains you to become more aware of your own state and of your body in a quiet moment, so that you can more easily assess your state of being, and also the state of your body and your nervous system throughout the day. And it's more easy because then you have had the experience earlier in the day and regularly. So if you then say, oh, I feel my breath has changed, I take a few grounding breaths now, and you need like 2 minutes to quickly reset yourself. And I often honestly combine these with essential oils that I love that increase breath awareness. Um, you inhale them, and actually components of the essential oils match receptors inside the human body. So it has an effect on several pathways in the body that, adds to nervous system regulation or pain modulation and stuff like that. So this mixture is very powerful and in a way to regulate your system. And does it affect my children? Yes, of course, because if it regulates me, if I show up differently, it affects my children. And it also increases the space I can hold for my clients and for my patients. So, and this is what I explain when I give presentations on this topic for colleagues. How stress is contributing to over 80% of complaints and diseases people visit their GP for, their doctor for. And it affects our breath. And when we breathe differently, it's a sign that our nervous system is potentially affected. And if our nervous system is affected, if we're busy and we're dealing with all the other things going on, and there's still someone in the room that we need to get rid of, it's not a nice way to think about it, but it can feel like that sometimes. Usually in that situation where you feel like, you know, I need to get this done, then the patient is not opening up about the real issue. So it takes even longer to get to the core of things. So yes, changing your state, regulating your state, becoming aware of it is an essential part of good healthcare, and also affects how you deal with everyone else in your own life. And it even affects, of course, the choices you make around food, around what am I going to do next? I'm going to take zone out and Netflix with a bag of chips on the couch. Or am I actually taking a moment to connect with myself, to feel like, hey, how am I doing? Scanning through your body, feeling where there's tension and how can I release it? Maybe going outside if you have an opportunity to walk outside, or tune into some favorite music, or do a breathing exercise, or change, move your body, twist your spine in several ways to release some of that build up tension. It is a very healthy way to connect to yourself. Because the body is constantly feeding us information like, how am I doing? And to get back to my profession, I see people with like wrist complaints and they tell me, oh yeah, I don't complain that fast, but now it's really bad. Now I've been sitting home for weeks. And somehow in our culture that is applauded upon, like, oh wow, that's so good. You never complain. That's true. And then we look at the x-ray and you see completely destroyed bones. Like the cartilage is gone, and there's so much sclerosis now, or like loss of bone and cartilage, that the only thing we can do is either take away some of these diseased bones or replace them with some artificial material, or just put in an implant. And although the surgery, it can be even like fun or interesting and can be helpful against pain, it is saddening to me that we have created this culture where it's so normal to keep going, suppress, take some painkillers, forget, don't ignore, and then we show up with something that's basically irreparable. Because often that is the case. The body is whispering first. And the moment we ignore this, and we keep ignoring this, eventually we'll start screaming. And screaming is usually in the form of big pain or disease. So it would be so much better if we could tap into our body that has kept us alive all this time and listen before it gets worse. That's my
Say that you can say that you have become a better doctor, a better physician because of this.
yes. Well, it's through embodiment, through the realization, also living from that experience, that you can share and inspire others. I mean, if you are not healthy, wealthy, or relaxed, when you share your visions on how someone else can be more healthy and relaxed, it's very difficult message to believe, right? I mean, if you want to know how to grow, build muscle, get stronger, or how to get smart, you want to hear it from someone who is stronger, smarter, with more muscle, or reads more books than you can. Or you want to know their tricks, how to get there, and you want, because you believe their embodiment. And it's the same with health. So I think the current system in healthcare where we have to do more and more and more, and there's more administrative pressure, and people are getting sicker and sicker and sicker. So we have to see more patients in less time and make it more efficient. And the whole food industry is not cooperative at all when it comes to healthcare. It is what you see is more stress also from physicians
Oh, yeah.
dealing with all of this. Well, it's very common to suppress the stress with a nice glass of wine, good wine or whatever, to deal with the stress of this daily life, or big holidays or nice cars. And they're all, especially the holidays and the living circumstances are beautiful ways to help you regulate. But it would be so much nicer if we would be more aware of the stress present and how it is impacting how we function and how we interact with others, because it is whatever we embody, we transfer. And the way we interact with each other determines also how open we can be in the connection. And the more open we can be in the connection, the easier it is for our client to show up with whatever they want to share. And the more open they are for potential suggestions for change or transformation or choices you offer. And I think making people see, or not making them see, but helping people see how they can impact their own well-being and health, that is the key to not only changing their personal health and well-being, but also changing healthcare, and also beyond healthcare to change how they show up in their daily lives and the choices that they make, the impact they have on the relationship with their others around them. From that place, how we interact with each other as a human species, and therefore in the whole world.
Don't you think that sometimes it's easier to go to the doctor and ask for a solution than start
Yes.
working on prevention yourself in whatever kind of area? And that is
Yes.
also a reason why things are not really flying in that
Yes.
sense.
Yes. And that is also why the hypnotherapy comes in, because in
Yeah.
general, it is easier to take a pill or let your doctor fix something, or even, get a membership for a gym. I remember that for myself for years. I realized how important it is to build muscle, especially after 40. And I intended to start before 50 to really grow muscle. And I was running 3 times a week, but I now knew I needed to build muscle. So I signed up, I got a personal trainer, and then I paid, I got a trainer, and then I actually had to go. And I felt all the resistance, all the resistance. And I knew, like, oh, this is it. This is where most people say, but I'm paying the membership, you know, why do I still have to put in the effort? Yeah, because that's where it happens. So hypnotherapy and becoming aware of your mind and your state of being, and also working on your state by thinking about where you want to go instead of where you are now and what you don't feel like doing in this moment. It's about self-discipline as a form of self-love, and we have to become aware that this one body is what we have, and that this is what we do life with. Through this body we experience pleasure, because we have all these amazing senses that you only start to love most of the time when you cannot use them for a period. But it's amazing that we can see, that we can hear, that we can smell, that we can taste, that we can feel the touch and the differences in temperature. And there's all these different things that we can pick up with our body. And even intuition or gut feeling is somewhere in the body. And it's very important for doctors to have it. But how to manage it or how to increase it, to better it, we don't know. We never talk about that. But it's important that you have it. So yeah, our body is the way through which we experience life. If you understand that, it will be so much easier to realize that you need to take care of your body, because life is fun, specifically when you are able to dance, to walk, to enjoy life, to take your bike to go somewhere, or to explore the world, or to just, feel the presence of other people, to enjoy food inside of your system. Yeah, that is in total awe of the intelligence of the human body. And if you get that, then lifestyle medicine, yeah, it's a way, but it's not an ultimate goal. But yeah, you just want to have your vessel as clean and connected as possible, and learning to understand the whisperings of the body before it has to scream, and it might be too late.
like you said, is for many, they come to you with if some things are already too late. Is that a typical Dutch culture, do you think? Or is it
Well, there
Western?
might be cultures where they're more connected to their body and where like in traditional Chinese medicine, doctors get paid until the moment the patient gets sick.
Ah.
Because that's basically when the doctor has failed. You either prevent disease, and when disease happens, that's when you no longer get paid. So people frequent their doctor before getting sick. They get herbs and all kinds of treatments like acupuncture or cupping or many other things that I'm not even aware of. But yeah, so that's a very different system.
Maybe that could be another approach.
Yes. So I think in the Western world, yeah, we're more inclined to enjoy all the easiness we have created in our lives. You know, prepared food, food that you can keep forever. We have access to everything. Pizza can be delivered right at your door. It's different from how life was lived before, and it's not necessarily all in our favor because we have been starting to neglect our body and the impact of stress on it.
Yeah, and there is a lot of unconsciousness.
Yes.
So it's you don't know all what's going on. It's 95%, I think.
95.
Still the number there. So you do things not realizing why you're doing it, but you already have done it. Adding on stress or
Mhm,
adding on yeah, different phases in life. Name it menopause. Then it's a sort of like everything starts to shift
mhm.
more, and then you can also apply the same things as you already said. No, go out, dance more, meditate, connect with your body, whatever feels really really good for you or what sticks to you. And by the way, are you going to the gym now? It was like you said, I
Yes,
paid, I go, you go.
I
Not
do.
the easy, not the easy way, but then at least you go. No.
Yeah, well, you have to actually go to make a difference and also to keep up the change. Yes.
Yeah, yeah. I remember old colleagues. They're buying new clothes for the gym, new shoes, and showing up, but they're never really going to the gym. Or was the whole process of buying something to motivate yourself, but then in the
Mhm.
end, not doing it because you still need to do yourself the work to get there.
Although sometimes feeling really good in your new gym outfit can be lowering the threshold because if you feel good, you generally show up better and work better. But yeah, it should not stop at the outfit, definitely.
And you said something about your work in the hospital. You say, I needed to make the stitches. I didn't like it. It was really ugly, but now I'm on reconstruction part. So I make it nice. I make
Mhm.
it beautiful. Is there then also the energy you bring into that? What is the effect on if you coming in a completely grounded state of mind and you do the operation and really everything looks nice in the way you have envisioned it? How does the patient react there differently on? Is there any difference there?
Well, obviously there is an effect of the doctor on the patient, and if you show up more regulated, and you can inspire the patient with that, and you can, mention and explain the importance of regulation in general in life, but specifically around healing and procedures they are about to sign up for, yeah, that can be helpful. So there could be a positive change, and people open to it may explore this and may prepare themselves by eating better, by carefully selecting nutrients to add to their diet around procedures, by planning in more rest and repair in that stage. But so not everyone is ready for that, and not every situation um, allows for that because there's also emergency surgery, obviously. But also, the whole system in the hospital is not necessarily based on one patient, one doctor. I think it would
I
be
know.
really nice if you come into the hospital and you interact with a doctor, that this is also the doctor treating you and seeing you after the surgery. But I can tell you, most of the situations in the hospitals are now, it's more random, because it's much more efficient. But if it doesn't matter who sees you, doesn't matter who treats you, doesn't matter who sees you after the surgery. I do think it matters, and definitely also in the stress levels of the patient, because there's more comfort in seeing your doctor that you've had the conversation with and then treat you. But it's for an individual doctor in the system, it's barely impossible to change or advocate these changes because it's just not efficient in planning, in organizing. So if I see patients that I've seen for longer, and they're open to it, or they've heard me speak about this topic, yes, they're open to it, and it's a very different course than people who randomly were assigned to me. Yeah, then still the impact of me being at ease or peaceful before they go under anesthesia or after, that can be helpful, but that's just a minor part, and it would be so much better to have people on board for their part in their own healing before the whole treatment starts. And in this moment, well, it's not a big important issue for the hospital to deal with prevention and lifestyle. It's not one of the things they focus on. So to create time or space for that, no. Would it impact that? Yes. I think if we can find ways to give to people to help themselves prepare for treatment, whether it's surgery or whether it's like cancer treatment, to regulate yourself, to support yourself, so you can tap into that rest and digest state of your physical body that is then more open to help you get through this treatment. Yes, I'm convinced that it's going to help more. And other than that, it's empowering clients to be part of their own treatment. So it's not just, me, the doctor, curing you, because that's a very skewed way of interacting with each other. And it's also adding to this drama system, like a drama triangle, where you have the patient as a victim, the healer as the doctor, and often there's this other part where there's a villain, either the employer who makes them work or the partner who never helps them out. There's this whole victim triangle going on, a drama triangle, that we still all take part in, because taking responsibility for the choices in your life is difficult, like we discussed, going to the gym, gotta love it. Taking responsibility is challenging, and at the same time it would also chip away from the incredible impact of the healer. If you realize that part of the healing actually comes from the patient itself, it means, well, maybe not all of it comes from your beautiful magic in your hands. And don't get me wrong, it's very important that you are skilled and that you know what to do, when to do, and how to treat someone else's tissue. But there is a big influence of how then the patient is going on and dealing with all the aspects in their own personal life. So when they see me regulated, it's nice. But if it's like 2 minutes before and after the surgery, because my schedule is just overflowing with everything and I've never met them before, it's not going to have a big impact. No. But if we can prepare them and guide them, and in general make people see the intelligence of the body and how they can impact that for their own benefit, for their own well-being and health, yes, then we have a different situation. So for my own sanity, it's nice to show up in that way. For working together as a team, it's beautiful to even the choice of music in the OR is impacting all of that. But the organization of the system in healthcare, especially nowadays, makes it incredibly challenging. I see so many more people turning towards integrative medicine, more holistic views. Mind-body medicine is more normal. Breathwork is getting more and more integrated in people's lives. So that is good, but well, pioneering is challenging, and it's not my goal to change the system. And this is also why I do the breath work, the body work, hypnotherapy next to the work I do in the hospital, simply because that opens up the space for people who are aware that they may be accountable for the choices they have been making, even though they were not aware. And how can we change this? How can we do it differently? So they want to show up. They want to take active action in their own life. And that is very relief. Like, it brings so much relief and also inspiration. Yeah. The only way we can change how we interact with each other on this whole planet, like beyond healthcare, beyond disease, beyond surgery, but on the whole planet, how we deal with all of each other, but also with the planet Earth itself. That comes from internal changes within how you show up and what you focus on. And yeah, so I love interacting with people who get that, may just get the idea, but who are ready to explore and expand that through diving into their own depths of their soul, of their being, of their intelligence, whatever you want to call it. And yeah, be really aware of how suppressed emotions may impact their daily life and choices and their triggers. Yeah, that to me is very freeing.
Like, so what is needed to get there? And you say the system is the system. I would like to support the people who are already open and aware, and then they can find you.
What is needed, what is happening now, that more and more people are becoming aware of the impact of breathwork, bodywork, and practices like that on our health and well-being. And then the changes that will more easily flow from that awareness of wanting to keep your body in better shape, in better conditions, so you can use it as the antenna it was designed to be, to communicate to you and also from you in both directions. That is a great step. And I'm trying to blend in these insights when I give presentations to colleagues, to young doctors. And then I talk about stress, the impact on breath, and then on their nervous system, and how then changing our breathing patterns affect our nervous system, and how we show up in interactions. And that is, it's actionable for most colleagues to say, oh, so it is helpful to release stress in a different way, or to become aware of stress and to deal with it. Because eventually, life is a combination of the stuff that you have been choosing, although it doesn't always feel like that. But the more we realize the accountability we have with the life we live, the choices we make, often unconsciously, the more empowered we can actually become to feel. And we can also realize, oh, yes, I could. If I wanted a different outcome, I should make different decisions. And often we need deeper insights or release of emotions guiding our daily life, triggers guiding our daily decisions to be able to make that change.
Hearing about the breathing and about the nervous system regulation from a colleague. You said I give the presentations also to younger doctors. I guess there is then also more acceptance to the fact that this is important and fundamental also in the healing process, in the recovery, but also for their own stress management.
Mhm.
Do you notice still a sort of skepticism among
Yes,
your?
absolutely. Oh, yes. I mean, I love it. I'm convinced there's so much more to explore in this topic.
Yeah.
This is why I try to bring the message I have really based on the audience I have. As a doctor, you're trained every day to how do you say that? You have to connect to the patient in front of you. You cannot always use the same words, but you have to bring across the same message, right? You have to adapt, you have to attune to their nervous system, to their level of comprehension. That is how you have to share your information. And this is also what we do here. So when I talk about breath work, and I'm a reconstructive surgeon, people are like, why is she talking about breath work? Or why is she talking about stress or the nervous system? So there is resistance. There's even anonymous complaints sometimes within my hospital
Mm.
about, me speaking on these topics, or using a term like integrative medicine, because some people feel very triggered by that word. And I've now learned to use the word integrative care. Fine with me. I think in general, the things we can do to take care of ourselves or to deal with the stress around treatment, diagnosis, follow up is a way of caring. And the way of caring is actually supporting our health and well being. So it's fine. So yes, there is resistance. If there's more responsibility for the patient in their own health and well being, so there is an effect basically of the patient, then that could potentially chip away a little bit from your power in influence in healing this situation, right? The moment you are the one fixing everything and the patient nothing, it's the power in your hands. So if it works out, it's amazing. It's absolutely amazing, and specifically for surgeons, I mean, we fix it on the spot. That's awesome. It is truly. But the moment you realize there's also power in your patient, it might not all just be you. So that may need to dim down a little bit and see it's not just you, it's also, other things. Yeah. And that requires a culture change also. And also some of the things are more difficult to study or more less popular to study. Prevention and the impact, new treatments or new surgeries or new drugs, that is all more sexy and interesting. But the healing of physical bodies has been going on for ages. And here we are living longer, but with more disease. So I think something needs to change. A little more humbleness, yes. Because it's nowadays, if it's still the case, even among healthcare providers, if you deal with stress by having a glass of wine at the end of your workday or the end of your work week, or maybe even a bottle, that is much more accepted socially than saying, oh, you know what? I'm going to sit outside, I'm going to take a break in nature. I'm going to breathe for, 5 to 10 minutes or maybe even 20. I'm going to do some yoga to improve my sleep. People are like, yeah, that's all, spiritual, blah, blah, blah. It's, Hmm. It's fascinating how deeply socially accepted some of the patterns are that are not necessarily good for your health.
And then you say it's still softly not necessarily good for your health.
Well, alcohol is toxic, let's face it, and it is very socially accepted. And
Yep.
and I think all the studies that may have suggested that it is good for you in a way actually mean to say that the relaxation one can experience with limited amounts of alcohol can add to a feeling of well-being. But that feeling of relaxation can be obtained in many other ways. And the toxicity of alcohol is not good for your system, period.
No.
It's not.
So what do you do when you go stressed? When you really feel like, okay, this is now I'm off. What do you need to feel grounded?
Well, the quickest way for me to reset is a breathing exercise. Obviously, very simple one, extending the exhale. So that
Mhm.
means that your inhale is of shorter duration than your exhale. And I personally often combine it with an essential oil, simply to smell the oil, because you bring it up in your nose, in your smell, and within seconds it enters the limbic system and the emotional system of the brain, impacting pathways of nervous system regulation in a profound way. It's fascinating. These pieces of essential oils from nature actually click onto receptors in our brain,
Yes.
adding to not only breath awareness, but also, well, to relaxation. So that to me is the fastest way to ground, to relax, to dim down, because the effects are twofold. And then, so for me, there's three ways to regulate stress. There's acute, like we discussed. What do you do when you need it
Yeah.
quick? Well, this is very quick. Recently, I was on a holiday and I had massages. I was in a beautiful hotel, and there was sauna and wellness, and there was fresh snow and the sun was shining. That is also very regulating, but that is not available, not to me. It has not been available to me for so many years, but it's not available for many people most of the time. So we need regular practices. There's acute stress management, breathing, quickest way, especially with an essential oil. Then there's maintenance. That is what I do every morning. Sit with yourself, feel what you need, what's going on, what can you do to support yourself. And then there's deeper work. The deeper work, when you keep on showing up in certain situations, where you keep on hitting certain levels, or you keep being triggered by certain situations, that is often has to do with your interpretation of what has happened to you in the past, or your interpretation or perspective on life. This is why you get triggered by certain actions of others, where some others may not be triggered. Realizing that and diving into that, so you can move through maybe some of the emotions attached to it by yourself, that is also freeing. Opening the awareness, realizing what you have been suppressing or not seeing, moving through emotions, releasing them, and feeling lighter after, and with more clarity about your life, and also that may have served you in the past and how it's not serving you in the moment. So from this day forward, realizing how you have been showing up and how you are now free to make a different choice, that is also helpful. And that is the deeper work. So
Yeah.
acute regulation, regular maintenance, to really get yourself, your body, your breath used to finding awareness throughout your days, so you can more easily say, oh, I feel my breath is quick and it's shallow, and it's, oh, my jaw is tense, oh, my shoulders are shrugged, my gut is affected. I may need to slow down for a bit, calm down to lower my breathing frequency. And then there's the part of the deeper work where you can really move through bigger stuff, so you don't carry it all along in your backpack of life, because that's heavy.
I was thinking only the heavy stuff appears in the moment it needs to appear.
Hmm.
That when you're ready to receive it, to let go, then it will appear.
Sometimes you have to be aware, or you have to create the conditions to be ready. You have to make the decision first, because otherwise we're inclined to just move on and quickly fill every time slot with something else, especially now,
That's
entertainment.
endless, of course.
Yes, yes.
It's endless. Focus is quite important.
What is our connection was based on breath and breath awareness. And I think that is a really beautiful start and a very powerful start for most people for more awareness in life in general. If you are aware that your breath is impacted by the level of stress that you experience in this life, whether you are really aware of it or not, if you become aware how you are breathing and you learn how to be able to impact your breathing, that by itself can be a great first step to impacting your life, your nervous system, because breath awareness is a part of body awareness. And when you realize your breath is following stuff that you were not aware of, but it is, then you maybe also be aware there's other parts of your body that actually demand your attention and invite you to show up differently, maybe, so you can have a better life and better health and well-being.
Something simple as our breath and so deeply connected to everything.
Yes,
Amazing.
because literally, when we breathe, we inhale parts of the
Yeah.
outside world and we give back parts of our inside world back to the living surroundings. And that air is shared by all of us. So that by itself is amazing in a way,
Fascinating. Yeah.
underlining the connectivity of everything. So yes, breath awareness, beautiful. And when we learn to feel better, to feel our breath, to feel our emotions, to feel our state of being, when we learn to feel better, we can heal better, because we can respond to the cues our body is giving us, and we can take care of the body better, and then we can enjoy the life even better.
That's an amazing, beautiful ending. Lidewij, thank you very much.
Thank you.
To close it off, we started with the bread and we end with the bread because that's all there is in the end. No? Thank you very much.